I once had a patient. They've been trying to conceive for the past 10 years, and they were referred by a doctor to come for pelvic scan. The doctor has been managing them for the past 3 years. Yes, that was the history. And they were referred for pelvic scan. So while I scanned the wife, the husband was, in the office as well, was inside the scan room with me. And he asked if he could talk to me. I said, sure, go ahead. So he asked me that can smoking be a problem? Or can smoking be the reason why they are yet to conceive? So I asked which of them smokes. He smokes a lot and he has tried to stop, but he couldn't. He has tried several times to stop, but he couldn't stop. So he then asked me if that can be a problem of if that can be the reason why they are yet to conceive. So I asked him if he has communicated this to his doctor. The doctor managing the wife and himself. So he said no, that he hasn't communicated it to his doctor, that he doesn't feel probably it's necessary. So I told him that it is actually necessary. I encouraged him to please communicate this to his doctor. Smoking and pregnancy doesn't mix. There are two things that doesn't go together. Either you're trying to conceive or you are pregnant already. Make sure that you and your partner quit smoking for that period of time. Smoking will only expose you and your unborn child to severe complications. Cigarette contains so many dangerous chemicals which are unhealthy for you and your unborn child, and it could cause serious complications that could be fatal either on the mother's side or the baby's side. You and your partner should please quit smoking. I'm encouraging you to quit smoking. Today I'm going to be talking about the risk that smoking while pregnancy puts you as the mother into, and the baby as well. And I'm going to be starting with the baby. The baby are vulnerable to cleft lip. Means there is going to be an opening at the the upper lips of the baby right here. It could be right here or right here. So it's going to open directly into the nose like this. So that is what is called cleft lip. Or there's going to be an opening at the roof of the mouth of the baby. That's number one. Number two, weaker lungs. The lungs of the baby is going to become weaker. And a baby that is having difficulty in breathing definitely is vulnerable to sudden death. Difficulty in breathing is what comes with a baby that has a weaker lungs. It exposes the baby to long-term health complications, even in adulthood. And another thing I'm going to be talking about is heart defect. There's going to be a problem with the structures of the heart. This could actually lead to sudden death as well. Healthy low birth weight is another thing that happens to babies that their mother smokes while being pregnant of. So unhealthy low birth weight actually expose your baby to so many things like so many complications like infections. Yes, babies with low birth weight, unhealthy low birth weight. Now, yes, unhealthy low birth weight could be vulnerable to infections, could be vulnerable to sudden death as well. So the next I'm going to be talking about is complications that comes for the mother. Number one is miscarriage. The mother that smokes while being pregnant could experience miscarriage. And number two is preterm labor, meaning that your baby could be born early, than the normal time that the baby is supposed to be born. So, of course, you know that such baby might not survive. In a nutshell, if you are trying to conceive or you're pregnant, quitting smoking should be your topmost priority for the safety of you as a mother and that of your unborn child. Thank you so much for watching. I hope you find this video very helpful. Don't forget to like, don't forget to subscribe, don't forget to share, and don't forget to comment. See you all in my next video.